Good day, my dear undergraduate students. We shall now crash through the 2-minute class. The first being the second one on leukemia. This is an overview of leukemia. The important keywords I have given in the box. Rudolf Virchow, the father of pathology, was the person who first identified it because he saw that the cells were abnormal. And there are different types of it. The earlier leukemia was a chronic leukemia, and Paul Ehrlich developed the different staining methods, whereas Nageli introduced the term myeloblast. By definition, an acute leukemia is a malignancy. It is a clonal disorder arising from the hematopoietic stem cell. And it is characterized by poorly differentiated blasts or immature cells. I would like you people to kindly go back to the earlier class to see the development of the WBC series. Now, what are the modes of inheritance? It can be hereditary, radiation, viruses, chemicals, chromosomes, acquired, and myelodysplastic syndrome. This you shall memorize. In case it is asked as an essay, this is how you should expand. Hereditary, for example, in cases of Bloom's or Fanconi's anemia and Down syndrome. MCQ is possible. Radiation, starting from atomic bomb up to X-rays. Ankylosing spondylosis was treated by radiation. Patient developed leukemia. Viruses, HTLV1 and Epstein-Barr virus. Chemicals, occupational disorders such as benzene, melphalan, and nitrosoureas. Chromosomal abnormalities, all of us know the Philadelphia chromosome. But then there can be others such as the translocation between 15 and 17. Acquired disorders can be in a case of paroxysmal nocturnal hemoglobinuria, and MDS can also lead to an acute leukemia. So this is in short about the etiopathogenesis, which we shall by heart. There is another classification. Earlier, I had shown you people the FAB classification that is of most importance. And the second one will be the WHO classification, which is given over here, wherein the blast count is more than 20% of the blood smear. And as per the FAB, you find the 30% is in the bone marrow. And the criteria can be any of these. AML with recurrent genetic abnormalities, AML with multilineage dysplasia, AML and MDS therapy related, AML otherwise not categorized. These are the different modes of categorization according to WHO. Going to the proliferation, you find that the marrow will be filled with these blast cells. Kindly by heart this. Now, what are the clinical features of a leukemia? Again, you find that there can be a bone marrow replacement, organ infiltration, vascular occlusion, DIC, and hypertrophy of the gums. So whenever there is a bone marrow replacement, patient can have an anemia, neutropenia, as well as thrombocytopenia. Organ infiltration, there can be hepatosplenomegaly or sometimes lymphadenopathy. Hypertrophy of the gums is seen in AML M3. The other manifestations can be vascular blockade due to the increased number of cells, or DIC, disseminated intravascular coagulation. Chloroma is a leukemia in a soft tissue. That completes the first class. Thank you.